Hi, I'm Dr. Kylie Dodsworth, and I'd like to talk to you about low testosterone levels, because we see this a lot in fellas these days, and women too actually, and lots of people just don't know why that's happening for them and what they can do about it. So testosterone is a hormone that we need for muscle strength and bone density and stamina, so that sort of structural stuff. Men have a lot more testosterone than women do, so they have bigger muscles, more heavy bones or more dense bones, and more sex drive often as well. Not always, but often. And so testosterone is an important hormone for those reasons. For women, we make the testosterone through the adrenal glands, which are little glands above our kidneys. And for men, they make their testosterone mainly through the testicles. So in order to have good levels of testosterone, we need to have proper function going on in the body. And what's happening these days is that we've got things interfering with that function. So one of the main things is actually being a little bit overweight. If people put weight on, particularly around the middle, so that's that tummy fat, and we call it visceral fat, which means it's sitting around the organs in our tummy. That particular fat is actually hormone producing, but it produces estrogen rather than other hormones. And estrogen's like the counterbalance to the testosterone. So if people start putting weight around the middle, they start to get more estrogen production, less testosterone production, and start to also get a bit more weight around the back, like the love handles or the man boobs, those sorts of things going on. So not having enough testosterone can be secondary to having too much weight around the middle. Why do we put weight around the middle? That's often because we're eating foods that are quite high in carbohydrate, or they're high in calories without necessarily being high in nutrients. And that stimulates a hormone called insulin. Now, insulin makes us store fat rather than burn fat. So high insulin states make us put fat around the middle, and that happens often because of there being too many calories in the food we're eating and not enough expenditure of the calories, like exercise. In addition, alcohol, really high in calories, and actually also interferes with liver function. And high alcohol intake can also make us get more estrogen production, more insulin production, less testosterone production. So the other thing that can happen is we can get stress. Now, most people have pretty high levels of stress these days. We switched on the moment we open our eyes in the morning, we're checking the phones. We're always available with emails and phones and people wanting things. And high stress levels raise cortisol, and cortisol also raises that insulin level and makes us put more fat around the middle. So there can be stress contributing, there can be dietary impact, there can be too much alcohol going on, not enough exercise. There's a whole range of these things that can contribute to low testosterone. Now, in addition, when we actually move our body and use the muscles, that sends feedback to the body. Oh, we're using muscles, we need to have some good testosterone. So there's also what we call a feedback loop going on. So if we don't use it, we lose it. So it's really important to actually make sure we're doing some strength training and resistance training to build those muscles, send the feedback we need more testosterone, try and get the weight around the middle to come down by changing the diet to have lower carbohydrates, some protein, not a huge amount, some fats, not a huge amount. You cannot go wrong with vegetables, as many veggies as you like. So look at that, look at moderating the alcohol intake, maybe just a couple of days a week, and keep the amount, fairly low. We say, 2 for women, 4 for men, but it depends on how many days a week you're actually drinking. So it's important to actually look at those different lifestyle factors. If the levels are still remaining low, then you can actually be tested, of course, to check those levels in your body. And if necessary, we can actually do some rebalancing using what we call bioidentical or natural hormones. So we can do a little bit of testosterone replacement if we need to. Generally just back to normal levels. It's not about going too high. It's about having the right balance. So have a think about whether the testosterone levels feel like they're all right in your body. Are you carrying a bit more weight around the middle? Are you doing what you need to exercise? Are you eating the right foods for your body? Is your drinking in moderation? These are the things to consider so you can start to create better health. So I look forward to talking to you next time. I'm Dr. Kylie Dodsworth, and you can find me at the website below. I'll see you then. Bye.